First things first, there are 9,049 cases of coronavirus in Victoria. That is an increase of 384 on our last update. There are 260 Victorians in hospital. 45 of those are receiving intensive care. I'm very sad to have to inform you that the total number of fatalities as a result of this virus has increased to 83. That's 6 additional deaths since we last updated you. If further information can be provided, we'll do so, but the details I can provide you at this stage are 2 people in their 90s, 3 in their 80s and 1 person in their 70s. 4 of those 6 fatalities are linked to private sector aged care. In terms of tests, we have done 1,536,628 tests since January 1. That's 18,521 since yesterday. There are 4,775 active cases across the state. 414 of those active cases are health workers. Some 769 of those active cases are in aged care. That, I think, is probably all the numbers I have to give you. Can I just again take this opportunity to offer my condolences and send my best wishes and support to the families of those 6 individuals who have passed away since our briefing yesterday. This will be an incredibly challenging and sad time for the people who love them the most, and we send our best wishes to them, our thoughts and our prayers. Now, I have a number of important announcements to make today that relate particularly to private sector aged care. I cannot stand here and tell you that I have confidence that staff and management across a number of private sector aged care facilities are able to provide the care that is appropriate to keep their residents safe. If I could say that, I would. But I won't stand here and say that, and I won't stand here also and say, oh, well, this is just a Commonwealth Government matter. We don't run this sector, but the residents in these homes are all Victorians. The Commonwealth Government have asked for help, and that is exactly what my government and our agencies will provide to them. So it is with some regret but a sense of absolute urgency that I need to announce that elective surgery other than for Category 1 and the most urgent Category 2 patients will be suspended forthwith. We will do our level best to honour those booked surgeries, so scheduled surgeries, but that will not run for very long. If you're outside the most urgent of Category 2 or in Category 3, although very little Category 3 surgery is being undertaken at the moment, then we will attempt to have your surgery done, but very soon all of that surgery will stop. So only the most urgent patients will be treated. That is appropriate because that will free up beds and it will free up staff. Staff is the biggest issue. It's not so much about equipment. It's not so much about capacity in a physical sense. It's about having staff who are able to provide care and support to the most vulnerable residents in and coming out of private sector aged care. To that end, I can also inform you, just by way of example, and this will be occurring in many different settings, Eastern Health and the Eye and Ear Hospital are closing beds currently. They will then move staff, principally registered nurses, Victorian Government employed registered nurses, into a number of aged care settings where there are outbreaks to provide care and support to essentially take over the clinical care of residents in those settings. Some of the stories we've heard, some of what's gone on in some of these settings is simply not acceptable, and it's not about blame, it's not about demarcations and having disputes about who's in charge of what. It's just about getting on and getting this done. The Commonwealth Government, I've spoken with the Prime Minister, ministers have been speaking, officials have been speaking. It was a very long night, but this is a critical challenge. The Commonwealth have asked for assistance, they've asked for certain things, and that's exactly what they will get. So, just to be clear though, this does not mean that every resident in an aged care facility, a private sector aged care facility that has an outbreak, will be moved en masse to a public or indeed to a private hospital. It'll always be based on clinical need. It will always be based not on the judgment of premiers or prime ministers, but on the judgment of the treating doctor and medical teams, many of whom will have been sent in under these arrangements. Where there is no confidence in infection control, where there is no confidence that care can be provided to a suitable standard, then we will do everything we can to move those residents out. We have the better part of 200 residents that have already been moved from private sector aged care to clinical settings, hospitals, both public and private. Ambulance Victoria has done an amazing job in that effort. And we've also, as you would have seen, one of the most challenging examples to read, and let alone as a family member or a resident actually experience the St Basil's outbreak. We have sent registered nurses in there, Victorian government registered nurses, to support the care and the well-being of those residents. That will continue. What that will mean for other Victorians is that a number of services will have to be constrained. Those procedures will have to be deferred. Ultimately, the sickest people must get treated quickest. And whilst this is not a sector that we have any involvement in, the residents, I stress, the residents are Victorians and we need to look after them. The Commonwealth have asked for assistance and that's exactly what we will offer. Beyond that, can I also indicate that all of these arrangements will be coordinated out of the State Control Centre. Governments, departments, agencies are all working very closely with each other. This is a shared challenge and one that we need to do everything we possibly can, and my commitment to all Victorians is that we will throw everything at this. We will do everything that we are asked to do and we will go above and beyond that. We owe it to each of those residents. We owe it to their families. Now, in broader terms, and Brett can speak to outbreaks in more detail, and Jenny may want to add to my comments in relation to some of the impacts that this will visit upon the health system. But I just want to thank Victorians who are coming forward and getting tested. I want to thank Victorians who are not going to work. Instead, they've got symptoms and they're staying home, they're going and getting tested, they're isolating. I want to thank the team. It's a massive, massive team of people who are working night and day to provide support and care, advice, assistance to everybody touched by this pandemic. I'm very proud of each and every one of them, and I'm very proud of every Victorian who is doing the right thing. We do continue to see some people who believe that their own liberties or their human rights are more important than human life. I just say that's a really bad decision. Not only is it a bad decision, it's not a very smart one, because Victoria Police, who are doing an outstanding job as well, and I send a message of support and thanks to each and every member of law enforcement, whether it be authorised officers of the Health Department, PSOs, sworn officers of Victoria Police, Sheriffs, Corrections Victoria staff, they're all doing a fantastic job. It's a bad choice to make, and it's not a very smart choice to make, because you will be fined, and that's about protecting others. Please wear a mask, and thank you to all of those, the vast majority of people who are. Thank you to those who are getting tested and not going to work. That again is a real challenge. We've got to do better at having less and less people presenting to work with symptoms. We've got to do better at people who are waiting for a test result staying at home and not going out, not going shopping, not going to work, simply waiting to get that result. And if they get the all clear, well, then they can resume going to work and doing all those important things. But you can be at your most infectious in that period between when you are waiting for when you've had your test and you're waiting for the result. That is, again, a really important message today, just as it was yesterday, and I'd be deeply grateful to each of you and your outlets to try and push that message as much as possible. If you are sick, get tested quickly. Stay at home till you get your results. And if you need support, well, there is support there for you. A $300 payment in the intervening period, and then a $1,500 payment if you are positive. I had hoped, I know I've mentioned this a couple of times, I've been asked a few questions about this, I had hoped to provide you an update on those grants. I can't do that today. We've been focused obviously on aged care matters, but I would hope to get you that update as soon as I can, certainly by the end of the week. And I think there was also some questions yesterday about wanting just a bit better sense of how many door knocks ADF and authorised officers of the Health Department had made. We're just compiling that data for you, and when we can take you through that, most likely tomorrow or Thursday we will do that. They're doing an amazing job. We're very grateful to them, just as we are to the Commonwealth Government and interstate governments who have provided lots of different support. But that door knocking is going well. They are finding people at home. They are sadly finding some people who are positive not at home, which is a real concern, and that's why that door knocking is so important. Overall, our split in terms of active cases between metropolitan Melbourne and non-metro, there's still a few being investigated, but it's in the order of about 4,500 and 180. So those cases are low in regional Victoria, but I thank regional Victorians for the way in which they're embracing the rules, the way in which they're not pretending that there's no rules. They know and understand that there are still structures in place. There's still an extra effort needs to be made to keep this out of regional Victoria. That's why if you're within 1.5 metres of someone, if you don't think you can maintain that distance, please wear a mask. Hand hygiene, cough etiquette, not going to work if you're sick, getting tested if you're sick. All of those rules, all of those points, in some respects, apply even more so in regional Victoria, because our tolerance, our keeping it low, keeping those numbers low is a real challenge. But regional Victorians are stepping up to that, and I'm deeply grateful to them. I know it is inconvenient, but keeping those numbers low is a must. So just to recap before I ask Brett to take us through outbreaks, and then Jenny can speak to some of the health system changes we have made in consultation and indeed at the request of the Commonwealth Government. I cannot stand here and say to all Victorians that I have confidence in some of the arrangements in private sector aged care. I won't do that. But I won't also say this is not a matter for the Victorian Government. That would not be the right thing to do. These residents are Victorians, their families are Victorians, we've been asked to help, and that's exactly what we will do. It will mean some inconvenience for patients outside aged care who might have had their elective surgery, or who might have to wait longer for what they need. But the sickest patients have to be treated quickest, and with so many outbreaks, the better part of pushing on to 800 active cases in aged care, it's very important that we make this a clear priority, given the fragility, the underlying health issues and the vulnerability of those residents. We need to make sure families have got much better transparency, residents have got much better care, and that we are doing everything we possibly can. I can make no promises about how successful this strategy will be, but every Victorian needs to know that governments are working together. It's not about drawing lines and working out who's responsible for what. We're all in this together, and that includes governments. That includes premiers and prime ministers, and that's exactly what we are announcing today. We'll do everything we can and more, because that's the nature of our health workforce, in anticipation and indeed recognition of some of the work that's already gone on. Can I thank those nurses, those doctors and others who are ending a shift, or would be normally expected to be in a public hospital, not doing that work, but instead going into a private sector aged care home and providing care and support. It is the most important of work, and we're deeply grateful to you. We often refer to those workers as heroes. This is very, very challenging work. I think they're equal to it. And if you value them, if you recognise the work they do, their skill, their courage, their care, their compassion, wear a mask, follow the rules, and we will not only honour them, but we will get to the other side of this quicker. I'll now ask the Chief Health Officer just to speak to any of those individual outbreaks, and then Jenny can speak about health system issues, and then we're happy to take any and all questions you have.
Thank you, Premier. Just to update on hospitalised patients, we do have 260 patients currently in hospital. That's an increase of 15 since yesterday, including 42 patients who are in intensive care. That's a decrease of 2 since yesterday. So our significant outbreaks at the moment, as we've said, are in private aged care. I'll run through a list of some. There are 88 cases now in Estia aged care in Ardea, 86 cases linked to St Basil's Home in Fawkner, 82 cases linked to Epping Gardens in Epping, 76 linked to Kirkbrae Presbyterian Homes in Kilsyth, 62 cases linked to Menarok Life Aged Care in Essendon, 53 linked to Glendale Aged Care in Werribee, 51 linked to Bapt Care Wyndham Lodge in Werribee, 50 cases linked to Estia Aged Care in Heidelberg, 40 cases linked to Outlook Gardens Aged Care in Dandenong North, and 39 cases linked to R-Care Aged Care in Craigieburn. There are a number of single cases in staff members in a number of other facilities. So today's numbers are pretty volatile. They will really depend on whether outbreaks occur with large numbers of residents in some of these private aged care facilities. When there's a single staff member, it counts as one, obviously. But if an outbreak has all of a sudden identified 30, 40, 50 new cases in a day, then they're going to add to our daily tally of numbers. Some other significant outbreaks, 99 cases in Somerville Retail in Tottenham, 89 linked to Batocchi Small Goods in Thomastown, 76 linked to JBS in Brooklyn, and 50 cases now at Australian Lamb Company in Colac.
Thank you and good morning. Look, I might start with, I guess, some more positive news, if I can, and that is firstly just to acknowledge that we've had a very challenging set of circumstances in the last 24 hours at the Royal Children's Hospital. You'd be aware yesterday we reported a baby there, two parents and a healthcare worker had tested positive. I just wanted to advise that the latest advice that I have is that all the results have been received, bar one result that's still pending of the babies at the NICU, and they have all come through as a negative. So I think that is very good news, very positive news that I wanted to share with the community, because I know that this particular incident is one that would have caused a great deal of distress to many, and I want to take this opportunity to acknowledge the amazing staff who work at that NICU at the Royal Children's, who are incredibly dedicated and devoted to their patients, and to acknowledge, of course, the great distress that would have been experienced to all the families involved at the Royal Children's. So just in terms of aged care, as the Premier has indicated, look, we have been working very closely with the aged care sector and with the Commonwealth Government as the funder, as the regulator of the aged care system in Australia. We have had some very challenging circumstances, and I have to say personally, I have found the last week very distressing to see the number of outbreaks that we have had across our aged care sector in Victoria, and also the number of fatalities that we have had. And I want to acknowledge the grief of all of those families who have lost a loved one, a very much loved member of their family in recent days. So the situation in largely private aged care has been very, very concerning, and we have taken steps today and in recent days to support that sector and to support the Commonwealth Government in its efforts. From last week, for example, we have had a very distressing situation at St Basil's in Fawkner. This is a facility that is very close, of course, to many members of the Greek community, and I know they have been particularly distressed to see the rising toll of deaths at that facility. So, I'm sorry. So from last week, there's a private provider that stepped in at St Basil's, brought in by the Commonwealth Government. Pardon me. We stepped in with support staff there. The Northern Hospital has been very much involved. They've sent doctors, registered nurses to support the staff at St Basil's, but it's been very clear that those steps have not been sufficient, and this is why I asked my department over the course of the last weekend to take steps to transfer patients, to transfer residents out of that facility. We now have, I think, about 35 residents remaining the vast majority of residents have been transferred to hospitals, largely to private hospitals across Melbourne, and I'm grateful to all of those private hospitals who have been able to assist us at this very challenging time. We have had, of course, continued pressures across aged care, and we have other facilities who are similarly experiencing significant pressures as a result of a lack of staff shortages. This is why today we are announcing some further steps in terms of pausing elective surgery, because it is important that we not only free up the bed capacity in our hospital system, but also make available additional staff to step in and support those private nursing homes as is required. So we have had now the ability to free up hundreds of beds in our hospital system. From today, we will have all less serious Category 2 surgery paused, as we announced in recent weeks, Category 3 surgery. This will apply to both public and private hospitals in metropolitan Melbourne and Mitchell Shire. Regional hospitals will not be impacted by these changes to elective surgery. I want to reassure Victorians that they will still be able to continue to access the most urgent surgery that they need, whether that's as a result of cardiac matters or trauma matters, which are our Category 1 surgery, as well as the most urgent Category 2 surgery. So they will continue to access that surgery as is required, and we will only be putting these measures in place for as long as it is absolutely necessary. We apologise to all Victorians who might have had their surgery impacted in this way for the inconvenience of that. We acknowledge it is inconvenient, and we will be looking to resume a significant elective surgery blitz as soon as it is safe to do so. So we've been working closely now with our public health services and private hospitals to put these measures in place. We believe that this will free up hundreds of beds, as well as workers, healthcare workers, to be able to assist private aged care at this difficult time. Can I just say to those families who do have their loved one in private aged care at the moment, we are taking steps to ensure that your loved one gets the clinical care that they need. In some circumstances, it will continue to be the safest option for your loved one to stay in that nursing facility. But where there is a clinical need, we will not hesitate to make sure that your loved one has a hospital bed available to them. So we have had already about more than 170 residents transferred to both public and private hospitals in recent days, and there are more transfers that are planned. It's not, as I explained, not always possible to transfer everybody. We've got very, very frail elderly people in these nursing homes. In some cases, they have dementia, and it's very challenging and stressful for an elderly person to be moved in those particular circumstances. But we'll always act on the basis of clinical care advice, and we have a team of doctors and nurses available from our hospitals who are assisting these nursing homes and assisting the Commonwealth Government at this very challenging time. So I just want to conclude by saying that every effort is being made to assist the aged care sector at a very challenging time. We have, of course, about 56,000 aged care beds in Victoria, so it's a very, very big sector. This is why we have been supporting the Commonwealth Government to ensure that this sector gets the assistance that it requires, and I'm grateful for the work that we have put together, myself with Minister Donnellan, working together with Senator Colbeck and Minister Hunt to address those pressing needs. And as the Premier referred to, we have now that Aged Care Response Centre, where we have Commonwealth officials working with state officials and others to coordinate this response. So I want just to finally reassure those families. I know this is a very, very stressful time for those families. I've had contact with some of the families in recent days. I know they are very, very anxious about their loved one's situation, but I want to reassure them that every effort will be made to make sure that your loved one can continue to get the care and the dignity that they deserve. Thank you.
Very good. Happy to take any questions you have.
Premier, how many majority of these cases, are there any in Victorian-run centres, and how many?
There are 769 active cases in aged care in total. 5 of those are in public aged care. We're about 10% of the overall market. We have about 180 settings and about 10% of the overall. I think we'd probably be the biggest provider of aged care in the state, or pretty close to it. But they are the numbers, Rich.
And they in one centre or not?
I think there's a couple of different settings, and it's a mixture of staff and residents. But we're doing everything we can, obviously, to keep it out of those aged care facilities, every aged care facility, but certainly those aged care facilities where we are the not only do we have a public health obligation, but we actually run those aged care centres. About 10% of the total.
Given this fairly dramatic intervention, should this have happened earlier? Like, given what happened in Sydney, Newmarch, was the writing on the wall?
No, I'd make the point that these circumstances are very different to what occurred in Sydney, and this is the most appropriate response. I'm not interested in any of those sort of games. I think, and what's more, we can't change what's happened. The key point here is to, I often say this, we're all in this together. Well, we are. Premiers, Prime Ministers, every single person across Victoria, we're all in this together, and it's appropriate that we have this dedicated focus. We make these very difficult decisions. It's not easy to say to people, this government's done more elective surgery, funded and had completed more elective surgery than any government in this state's history, and we're very proud of that. But it's not easy to say people will have to wait longer for the care that they need, but the sickest patients must be treated quickest, and that's exactly what these arrangements will do.
As the situation stands, do you have a rough idea how many residents you're likely to have to move?
Lonnie, it's a great question. I've asked those questions myself because you always want to try to get a scope of how big the problem might be, how big the challenge might be, I should say. It's really difficult to try and put a number on this, and I would just again make the point, the vast majority of residents, it will be safer for them to stay in their home but get additional care, and for their family members to have confidence that their needs, from very basic needs, which are more about welfare and care rather than clinical treatment, will all be to an acceptable standard. That's what we want to get to. It's going to be a massive exercise. There will be residents who are moved out and become patients of our hospitals, both public and private, and that's an important partnership. But there will be, I think, many more who will stay in place but will benefit from in-reach teams, if you like, just like what happened at St Basil's late last week, where there had been some staff sent in that didn't work, so we then sent in a dozen or so registered nurses, so nurses that would normally be working at hospitals like the Northern Hospital, and I want to thank them for that work. That's very, very challenging to go into a setting like that, but they've stabilised that, they've saved lives, they've done their very best, and we are in their debt. So all these rules, all this inconvenience that everybody is experiencing, if for no other reason than you want to honour the work of our health professionals, and if you want to thank them for putting themselves in harm's way to keep other people safe, please keep doing the right thing.
Premier, last week the interventions with some of the federal interventions, families couldn't get any information about their loved ones.
Yes.
What guarantees can you provide that this intervention will provide?
Yeah, we want to fix that, and we are working very closely with the Commonwealth. Obviously, we don't have a lot of this data. Again, when you don't run the place, it's very difficult to even have a list of who's in there. But we'll work through all of those things, and that dedicated focus in, if you like, a state control centre inside the state control centre, specifically and exclusively dealing with aged care, private aged care. That's exactly the thing that we need. And as I said a moment ago, I want to make sure that there's a greater comfort for families as well as their loved ones, better care, and a better flow of the information, the transparency that people are fundamentally entitled to. There will be, I'm sad to have to say, there will be many families who will be rightly worried because their relatives are sick. There are others who they perhaps have no alternative but to worry and to be absolutely distressed, and it turns out that their relative is not ill. It's just a function of getting the best information, the facts to people. So we're working with private providers, we're working with the Commonwealth to make sure that that important feature of this response is better than it has been.
Some of these homes have failed these residents at every single level. They've failed these residents and their families. They're not caring for them protecting themselves or their patients. They're not even communicating with loved ones. How are these places even accredited and allowed to operate?
Well, look, it's not my job to stand here and be a commentator, and it's not my job, and it's not helpful for me to be running critiques on other governments or other systems. That's not helpful. We don't accredit these places, but that is not the issue. Having a demarcation dispute, having a finger-pointing exercise between governments, that is not something I'm prepared to do. We've got to get this done, and we will get this done in partnership. The key point, perhaps the best way to answer this question and any other questions that want to kind of dissect private sector aged care, we are having a Royal Commission in this country into this sector, and I think that is exactly the right thing to do.
Last week, the Health Minister specifically said that sending patients from aged care facilities into hospitals, this same plan was definitely off the cards. So can you just go into a little bit of the...
No, that's not what was said at all, Alex. At all.
When they were asked if they were going to move patients out of aged care facilities,
No.
it was a no.
Having stood here for a few days and having answered every single question, Alex, if memory serves me correct, and I'm happy to have the record checked. I think there might have been a question, because it's been put to me as well. Will you move every aged care resident into a hospital? And the answer to that is no, because I don't have 50,000 hospital beds lying empty, or the staff to be able to provide them with care. And just a small matter, that many of these people will not need to move. And it is a deeply traumatic thing, particularly for psychogeriatric patients who have dementia or whatever other challenges. It is a deeply, deeply distressing thing to move them from their home, a familiar environment with familiar staff, into an unfamiliar environment. The answer to the question, perhaps rather than quibbling over what was asked when and what answers were given.
To clarify when the...
No, sorry. I was just going to make the point. The ultimate answer to your question is that we have moved patients, and we will continue to. And if there are anyone who needs to be moved, will be.
Has a timeline, when did the Commonwealth Government request this kind of level of assistance?
There's been discussions over the last day or so. I've had quite a few communications with the Prime Minister. We are absolutely as one. We are united and agreed that given the circumstances we face, which, further to your point, although I don't think that exact question was asked, but the issue is things are different. Things are different today than they were yesterday. Things are certainly different this week than they were last week. But I'm not into trying to conduct the Royal Commission into private sector aged care from this podium. That is not a luxury that I have. It's also not my job. My job is to work with the Prime Minister and do whatever we can, noting that they have asked for assistance. They've asked for very specific things. We are delivering all of that and more. And I'm very confident that our health professionals that work in our public system and those who work in our private hospitals, and when I talk about private aged care and some of the comments I've made there, don't read that to include private hospitals. We've got two services, a public service and a private service when it comes to hospitals, but they are working together as one system. And that is really, really important. And that's a product of National Cabinet decisions.
On the matter of the Royal Commission,
Yep.
the AMA is asking for a Royal Commission into the entire of Victoria's response, larger than the judicial inquiry that's going on. Do you support that?
I'm not focused on those matters. They're entitled to their view. I'm not focused on those matters. I think we're a long way away from those sorts of issues. We're far more focused on doing everything we can to provide care to those who are sick, to have the best set of policies, best public health response we possibly can have. We're in the middle of a second wave. That should be and that is my exclusive focus.
How many aged care centres have been identified as needing these highly trained nurses? How many nurses? Have you got a number?
Oh, look, there's some of the outbreaks that Brett has spoken to. They're certainly all on the board, if you like, things when we're looking very deeply and closely at each and every one of those to see whether there are additional supports that we can provide. It's very difficult to give you a number. Back to the earlier question about how big might the task be, we do our level best to try and get a sense of how significant the challenge is now and how big it might get. But the honest answer, Rich, is I can't tell you how many nurses are going to be needed, but that's why, for instance, and no government certainly not one that's prided itself in providing more healthcare, not less. No government likes to be closing beds, but Eastern Health and the Ioneer Hospital are doing that, so that not the beds but the staff can then go and work shifts in private aged care and provide that higher level of care where we can all be confident about that. Some of the stories we've read, some of what's gone on here is completely unacceptable, and we should just draw a line under that. That's done. None of us can change that. Now we have to make sure we all work together to try and do our best to provide the care and support that people need.
Have there been total number, Brett, if I could, there's I think 380.
Yep.
About a third of those
84.
are from the nursing homes. And so where are the other ones? Are you seeing, do you have like some confidence that there is a little bit of stability at all? Or not?
Out of today's total, there will be a significant proportion that are related to aged care. There'll probably be an equal proportion that are related to other outbreaks in some of those listed settings that I've given you. But they all get worked up through the course of today. We will look, as my intelligence or epidemiology team will look into the trends over time in terms of individual community cases versus those that are linked to outbreaks. That'll give a much better picture to me about what the general trend is for the things that contribute to outbreaks. It's really those community cases where people are having to work or going to work and causing transmission in those sites. But I think the numbers that we see day to day now are very much driven by outbreaks. But of course we have to get on top of the individual community cases that are occurring where we don't necessarily know where they've picked up the virus in order to get on top of these outbreaks.
So is the R number still below zero as it stands today?
So the R number, I haven't seen it since 2 days ago. It gets calculated a couple of times a week. It'll be very close to 1, if not below 1. So there should be a downward pressure on transmission in the community. But again, whenever you've got settings that allow for significant outbreaks to occur, that can also drive that R number up. So we need to get on top of the outbreaks. We need to make sure that they're not being seeded by community members having ongoing transmission.
So people are in quarantine because they've tested positive to the virus. Are they allowed to leave their homes to exercise?
Yeah, they are. They are. Otherwise, it's detention. We don't have detention for cases in Victoria. They are entitled to exercise, we would say, within their home and their garden, ideally.
But your directions say that they're allowed to leave their properties to exercise as long as they stay 1.5 metres from other people. That would appear to go against what we've been hearing for months about, what people should be doing in quarantine, wouldn't it?
So people who have no garden have no other option, and they have a right to exercise. And so the Victorian Charter of Human Rights and Responsibilities is pretty clear that if you aren't giving people an option to exercise, then you're effectively putting them in prison, and that's not something that can be done for a case of coronavirus or for anyone else for that matter.
So someone could go to their local park as a confirmed case and be walking around?
So we provide guidance to individuals to absolutely limit the potential interaction with others. We ask that they stay 1.5 metres away from all other individuals all of the time. We would say wear a mask. Obviously they have to now if they're in Melbourne and Mitchell Shire, we would say that they should do that to the minimum required.
Brett, just on contact tracing, I know you and the Premier keep saying we've got the capacity to do it, we're ramping up if we need to. We keep hearing, and all of us in all of our organisations have all heard stories of people who just have not been contacted in what we would all describe as a timely manner. Why is the system failing to contact the people who need to be contacted, and how can it be improved?
I'm certainly aware that all of the cases that get notified into the department are allocated to our interviewers and are interviewed within 24 hours. There are a number who haven't been able to be contacted. So for people who say they haven't been contacted, there might be a number of reasons. Maybe they've missed a call. But we are using the ADF now to do those door knocks to find people who, for whatever reason, haven't been able to be contacted. Maybe their phone's been off. I'm not sure of the specific details. There are some phone numbers that get transcribed incorrectly, but the address is there, and so they need to get chased up through other mechanisms. So there can be a number of reasons, and out of 10,000 active cases or 10,000 cumulative cases in Victoria, there will be many, many people who haven't been able to be contacted for whatever reason. There are circumstances where we're calling people and they say, oh, I wasn't even aware I was a case. So we've been notified as a department, but they haven't necessarily been notified from the pathology lab or whatever other mechanism they've had. So there will be issues when you're doing things at significant scale, but there's no question that we're allocating those notified cases to the department for interview, and that's getting done within the same day wherever it's possible. So if someone's picking up the phone, that interview will be completed.
It's not just that step though, it's the next step of then contacting their close contacts. And we've heard from businesses who say that they've given up hearing from DHHS, they're doing it themselves. I don't think that's a situation any of us want, is it? Why the delay in contacting the close contacts?
So we do have to interview the individual to get their close contacts, and we have to enter those close contacts in. So again, that's happening when the interview is completed and we can identify all of those close contacts, get them into the system. They're getting that automated SMS message through our Whisper app. But there will be circumstances where an individual at a workplace will say, oh, I've got my result. I'm a positive case. Until we receive that result, until we've interviewed that case and identified their close contacts, we can't get to those close contacts. So it is incumbent upon that individual to try and identify their close contacts and let people know, to the extent they're comfortable and confident, that they're a case and that their close contacts need to quarantine.
But the issue can't only lie with them though.
No, it doesn't.
People are like 5, 6, 7 days waiting before their workplaces are even contacted.
Yeah, so all I'm saying is that for the cases that are notified to the department, we've got a system now where those interviews are done and the close contacts are identified and the close contacts are contacted as well. There might be circumstances where someone gets their result as an individual and informs their workplace, but we won't know about that until we've conducted the interview with that person.
DHHS has been telling GPs and other healthcare workers that they can't test family members and close contacts and workmates of positive cases unless those people have been contact traced by DHHS and been confirmed as possible close contacts, unless they have symptoms. Is that helpful? I mean, GPs are obviously, they've got a family member they know has had contact, they want to test that person. Why is DHHS advising against that?
So close contacts don't need testing necessarily. Close contacts are people who've been potentially exposed to the virus. What they need to do is do their 14 days of quarantine. That means isolating themselves in whatever setting means that they're not putting other people at risk should they develop symptoms. Getting tested during your quarantine period is something that we do in particular outbreak settings. For the general community, being a close contact means you do 14 days of quarantine.
But a lot of these people are people who haven't officially been declared close contacts. They're people who know that they were working alongside someone or living with someone who's been a confirmed case. They haven't had their letter from DHHS yet because the contact tracers are behind. They're trying to do the right thing, go get tested, find out whether they have the virus, and DHHS are telling them that they can't get tested. Why is
So
that?
anyone who's a close contact can isolate themselves and they should do their quarantine. They don't need to be tested unless they develop symptoms, and we would prompt them, if they're known to us as close contacts, to get tested when they develop symptoms. But going without symptoms could be a false reassurance. When you're in your quarantine period, you can develop illness at any point in that 14 days. So if you're a close contact and you say, oh, I want to be cleared, it's been 3 days since I was exposed to this virus, and you get a negative test, that doesn't mean your quarantine period ends. You have to do 14 days of quarantine.
In a quarantine period who wants to know whether they have the virus.
So anyone who's got symptoms should go for a test. We've said that across the board, and they can. Anyone who's got symptoms should go to one of the over 160 testing sites in Victoria and get tested.
Are you aware of any any healthcare workers in ICU, and do you think that all clinicians who work on COVID-19 should be provided with N95 masks?
So it's not my call to make PPE recommendations for healthcare workers.
If you were working on a COVID-19, what would you prefer, a N95 mask and a surgery?
Oh, it's not up to me. I would follow the advice as per the state and national guidelines. There are circumstances where the risk changes in a particular health setting over time. I know the Chief Medical Officer, Professor Andrew Wilson, has made recommendations about when N95 masks might be appropriate, and the risk can change over time. And so if a health setting changes that risk categorisation, then it's really up to that health setting to make that recommendation to its staff. But it's certainly the case that you can move to a higher level of risk where an N95 mask might be more appropriate as a frontline worker, especially in ICU where you're working with positive patients all of the time, that might be the appropriate PPE to wear.
And so do you know many healthcare workers in ICU?
No, I'm not aware of any.
What level is the contact tracing team at? We're still at 2,100.
I'm not sure what the staffing numbers are for the contact tracing team. I do know that they're completing all the interviews that are coming in on a daily basis.
Is people are getting their test results?
Whereabouts are the aged care residents likely to be moved? Will they be going into, say, somewhere like the old PMAC or a specialist facility? Where do you
I think it'll depend, Lundy, based on their clinical need, basically. So there's additional ICU capacity been stood up right across the metropolitan Melbourne area, and indeed in some regional settings as well. So based on their need, we'll try and put people into the into the bed, into the facility, where they can get what the treatment they need as fast as possible. That won't just be public hospitals, it'll be private hospitals. And again, I'd just make the point about that really important partnership. That served us well right throughout this global pandemic. So it won't exclusively be public health services, it'll be private hospitals as well. And again, just to stress the point, it won't be everybody in every nursing home, but where that's deemed clinically appropriate, not by the Premier or the Prime Minister, but by a treating doctor, those residents will be moved. The other option, one that we're doing a power of work to try and build a really big workforce that can go into private aged care and provide a higher degree of care and support. That's the other project that we're working on. That's the one where it's, I suppose, a bit more direct in terms of our planning. But all of this has been coordinated by that State Control Centre within the State Control Centre that's got federal and state agencies. They're all working very hard and they're working closely together.
If we are getting their test results for about a week, just how out of date are the daily statistics?
That's not the advice we have from laboratories. I think our average turnaround time is around the 2-day mark. That is an average though, so there will be some that wait longer, some that are in fact prioritised. I don't think anyone would begrudge the tests that were done at the neonatal intensive care unit at the Royal Children's Hospital. They were clearly prioritised, as they should be, because of the fragility, the underlying issues. Those bubs are in neonatal intensive care for a reason. So we are prioritising a number of different tests. We try and be as fair and as clinical and as evidence-based as we can be in that. But my latest advice was that the turnaround was still in the order of around 2 days. That is an average though. There will be some that are quicker and there'll be some that are longer. The labs are doing an amazing job, working as hard as they possibly can. The key point there is that even at 2 days, that can be a real challenge for some people, particularly those that are in casual, insecure work. That's why there's the $300 payment. That's why there's the $1,500 payment if you are positive. And again, I just take this opportunity to make the point that if you are sick, even mild symptoms, you've got to get tested, and you've got to get tested quickly. And then you can't go to work. You've got to stay at home while you wait for your results. And then if you're positive, then you'll be given detailed advice on what you have to do from then.
In terms of the masks, where are we with distribution and how many we have? And
Sure. So of the reusable masks that we've ordered.
Given out to the vulnerable?
Sure. I haven't got. I will freely confess I haven't got an update this morning. I'm happy to get you one, and we can provide you with further details. I think we've spoken directly to some of the criteria, some of those vulnerable cohorts that are going to be getting those reusable masks, but I haven't got, as of today, an updated number. And orders are coming in every few days. So, Alex, let me come back to you on that.
How many beds are being freed up by the cancellation of Category 2?
I wouldn't say I think the best way to look at it is less beds and look at it more in terms of staff. And there will be literally hundreds and hundreds of staff that will be available to be deployed to treat different patients, private aged care patients, or to go into private aged care homes that would otherwise be doing medical surgical work. So working on a medical surgical ward. Some patients, not so much because of elective surgery, ICU capacity won't be affected too much out of this. Because those categories, and this is really important to set everyone clearly, there's no doubt about this. If you're category 1, so you're a cancer patient, if you were someone who had a cardiac condition, whatever it might be, you will still get your surgery within the clinically recommended time, that's 30 days, and the most urgent, so almost category 1A, so the most urgent of category 2, they will still get their surgery as quickly as possible and within the clinically recommended time, which if memory serves correctly is 90 days. The less urgent category 2s will be paused, and category 3 is paused as well. But I again want to stress, it's not me sitting down looking through patient files determining who's going to get their surgery and who waits. Doctors will do that, and that's a challenging job, but they'll look very carefully who's stable, who can wait, hopefully only a matter of weeks, to be able to get their care.
With the staff that are currently in the aged care centres where the nurses are going in,
Yes.
will they, the ones that are healthy, the ones that aren't sick,
Yes.
will they stay there and work alongside the nurses, or are they being stood to the side?
No, I think it'll work best when it's a team, but we have to be focused on the health status of those people, their training, their sense of infection control, all of those things. Look, to be honest, Rich, I think that'd be trying to integrate two different teams. That'd be a great problem to have. I think what's going to happen here more and more is that entire workforces, but a handful of staff, are basically out because they've got it, or they're a close contact, and we'll be moving in with squads of nurses who won't necessarily be a full complement, but their skill levels are higher, and there might be a smaller number, but they're able to stabilise things. It's also about triage as well, so they'll be able to monitor and be part of that chain of care, if you like, so that if a person deteriorates, if their status changes, then they can be making that in real-time recommendation to move that resident into a private or a public hospital bed.
And are those nurses that are going in, are they, told they're going there, or are they volunteering internally? There'll be a proper discussion with each of those staff. They would obviously need to consent to that. Yes, that's happening today. There are beds closing at Eastern Health and the Ioneer Hospital. There were nurses, Victorian Government nurses, that went in to St Basil's late last week and over the course of the weekend. We're doing this already. We're just taking it to another level because the challenge is at another level.
Was one of the issues with St Basil's last week the fact that existing staff were ordered out, and obviously they had to be to some extent because some of them had the virus, but there was very little consultation with those staff about, things like where the medicine's kept, all that kind of thing. It was just a complete replacement and not much of a handover.
Oh, look, I made the comment before that there were some other staff were sent in there that didn't work particularly well. That's not a criticism of them. That's just a fact. The better arrangement, and the arrangement that was deemed necessary, was to send Northern Hospital, so Victorian Government public hospital registered nurses, into that aged care setting, and they were able to stabilise it. It was a very challenging thing, but nothing we say or do now can change that. It's not part of the Victorian health system, but we sent nurses from our health system into that aged care facility, and I think that almost certainly has saved lives. Or if it's not been able to achieve that despite their best efforts, families have got the information they're entitled to, residents have got the food and the care and the real basics that I think everybody's entitled to.
Have there been instances of Victorian public hospitals refusing to take aged care patients when the providers have wanted to send them to public hospitals?
Well, what I'd say is this: if a private aged care provider basically decides that they have nowhere near the clinical capacity, COVID or no COVID, and they would like their entire aged care facility to be moved en masse to a public hospital, less based on clinical need and more based on the fact that they're not interested in doing this work, then absolutely hospitals have the right to say, no, I don't have 50,000 beds, Rachel. We will never have 50,000 beds that we can simply hand over. So I do know of some instances where hospitals have pushed back and said, hang on a minute, we'll take the people who need to come to hospital, but you can't just say you're closing your doors and everyone can just move to a public hospital. That just doesn't work. That doesn't work. That's not, just so people are clear, that's not governments. Governments are not talking that way. Governments are not working that way. But there have been some private providers who, their first thing to do is to call 000. And, I don't want to run too much of a commentary there, but I would always reserve the right of hospitals to make a clinical judgment on who should come. And there's an abundance of caution in that. But the notion that you can, I've got 2 or 3 cases and I'd now like you to assume 100% responsibility for the business I run, that is not the sickest patients getting treated quickest, and it is not unreasonable for hospitals to say, hang on a minute, let's go through and properly triage, let's do a clinical assessment on each of these, let's send you some staff. So I don't see that as a criticism at all. That's just making sure we make the best use of the best skills.
Any further thoughts on schools, given there's increasing anxiety amongst staff about students?
I'd simply say to our teachers and support staff, principals, the whole team, you're doing a fantastic job. The public health advice has not changed. It is very low risk, but the reward is very, very significant in terms of getting our Year 11 and 12 students through. Attendance rates are still high. They're not very much different than what they were this time last year. So that says to me that whilst there is a degree of concern and people are anxious about many of these issues, nothing about this pandemic is easy. Parents are still sending their senior students. Some parents who have to work and can't provide flexible and remote learning are sending, for the purposes of doing that remote learning supervised, they're sending their kids. If that allows them to continue to work and they're healthy and all of that, that's absolutely fine. And special schools have been dealt with. They've been given a treatment that reflects the complexity of those students and their needs. Again, that's not necessarily for every parent, but that policy setting came from listening to many, many parents across the specialist education spectrum. Beyond that, if the public health advice changed, then of course our policy on schools would change, but it has not.
Some schools have been closed and reopened 3 times, and we now have the principals saying they've lost faith in the health department.
Well, again, I don't think that's a fair criticism. I think everyone's doing their very best, and if there is a well understood framework in schools, I'm not expecting any principal to be pleased about the fact that they have had multiple positive cases in their school. The nature of a second wave is just that. You can have outbreaks in similar or closely connected environments multiple times. I think our teachers and support staff are doing an amazing job, and I'm very grateful to them. But the public health advice has not changed. And I stress, if this was seen as too risky, if this was seen as different in terms of the risk it posed, then our policy would change. As it is now, we've got a well-proven policy around even one case in a school, closure, deep clean, get the school back up and running as soon as we can, testing, all of those things. It's not a pleasant experience for a school to go through, but we've got to get our Year 11 and 12, particularly our Year 12 kids through, and that's what these policy settings are all about.
Was one of the problems in aged care the fact that staff were using PPE properly, they were putting it on, taking it off properly, and that's how it's spreading throughout the session?
Oh, look, I think that it's very difficult to... Well, look, I'll put it to you this way, Rich. I'm not much interested in going into those matters. That's just going to finish up being interpreted as us having a go at other people. That's not our issue here. What's gone on has happened. What needs to happen now is that we all continue to work together. We get the best care for those who need it the absolute most, and that's exactly what we're going to do. This system is not part of our public hospital system, but we will send our public hospital nurses in to provide the care that's necessary, and we will facilitate with Ambulance Victoria the transportation out of residents who need to go to either one of our hospitals or to a private hospital. And again, I thank the private hospital sector for their partnership. That's what we've got to be focused on now. That's what we've really got to be focused on now.
Would you be comfortable having one of your relatives in a private aged care home in Victoria right now?
Well, my mother is in her mid-70s. She has some underlying health issues, but she lives at home. some of the stories we've seen are unacceptable, and I wouldn't want my mum in some of those places. But that's not a matter for me. I can't change that. I'm being as frank. I'm not going to fudge. It's a good question, Laurel, and I'm not going to fudge the answer. I would not let my mum be in some of these places. I just wouldn't. But that's not a decision that I have to make at the moment, because she's living at home and she's very happy to be at home. And if she's watching this, she'll be very angry that I'm even contemplating the notion of her going into residential aged care. But you've asked me a straight question. I've given you a straight answer. I don't need to so much worry about those issues right now, because we've got a Royal Commission into this sector. And if anyone had any doubts about the need for that Royal Commission, well, hopefully that's now beyond doubt.
Can I ask Brett?
Yes, you had a question, yep.
When we talk about residents being transferred, what are the kind of criteria that would cause someone to be transferred, both in terms of the home that they're in or in terms of their own personal circumstances?
Look, I'm not on the ground to understand how some of those decisions are made, but it'll be a balancing of what the clinical needs are, what the other welfare needs are, the comfort of that individual in that environment. As the Premier said, there are many people who find it deeply disorienting and distressing to move, and if they have some underlying conditions, psychological or physical conditions that make a move very challenging, then that's absolutely a consideration as well. They might have pre-agreed wishes about the level of care that they might receive. If they've got a very strong desire and it's clinically appropriate that they get very active treatment, then hospitalisation, especially for a COVID positive resident, is appropriate. There will be others where their express wish and or that of their family is that if they were to be severely unwell, that they would want palliation or end of life care, and most probably where they're already resident. That's entirely appropriate, but that's a very individual decision to be made.
Are we at the stage where if a family or if a resident wants to be moved to hospital, they'll get that move?
As I say, it's always been a discussion between the receiving service about whether that clinical need is agreed, and the judgments about what the benefits or risks of that move would be.
Can I just ask you about Manarock? Manarock seems to have a staggering amount of cases. My understanding was they actually have 35 residents. It almost seems like every single person in that facility has contaminated.
Yeah, I'm not aware of the complete number of residents at Manarock, but coronavirus can absolutely infect 100% of people in a closed setting where there is insufficient control of transmission. So it would not be inconceivable that everyone has tested positive in some settings where the transmission has not been identified, and between staff or between residents that transmissions occurred.
You've
Have there been
released
any links yet?
numbers of infections at aged care facilities. Is there a reason that you won't tell us how many deaths aged care facilities have been responsible for, individual?
Oh, for individual facilities, I don't think it's reasonable. That can become potentially identifying information. When you're aware of a specific single death in a specific facility, then that individual might be identifiable, and that would be highly distressing for the family in certain circumstances. So I think that's the main reason. I mean, obviously, we're not hiding the deaths that are occurring on a daily basis, and in terms of the aggregate deaths that are occurring in aged care, we'd be very happy to report that. But when you get down to individual settings, you are at risk of identifying individuals.
Isn't it part of making these facilities responsible for what they call it for?
Oh, I think there'll be no question about accountability for all of the care in aged care, and it won't be the public dissemination of individual deaths for those facilities. That will be known to the Commonwealth Accreditation and Quality Assurance body, and it will be known to the State Health Department as well, but it's not a matter for public dissemination necessarily.
Does a member of the public have a right to know if their mum or dad's in a facility that's caused...
As I say, it's a balancing of risks for the same reason that we don't tell people about individuals with a notifiable disease. We wouldn't want to identify potentially someone who's died in an aged care facility where it then becomes known that they've had coronavirus.
Has there been any links between the aged care sector cases and the hotel quarantine, or can you rule that out at this point?
I'm not aware of any connection whatsoever.
Right, the Premier says what's happened in these aged care centres is completely unacceptable. These aren't lay people though, these are people who are supposed to understand health. Have they let you down?
Look, it's not my judgment to make, honestly. I am a public health physician. I'm focused on controlling coronavirus. It is for others to make judgments about the health service provision.
Just on contact tracing, Greg, we heard recently there was a backlog of about 1,000 people to be contacted. How many people are in that backlog now?
I'm not sure. I'm happy to look into that. Again, a number of it can relate to people who were never able to be contacted, but I can come back on numbers.
I'll just finish up by saying I want every family of every resident in private aged care more broadly, to know and understand that the Prime Minister and I are working very closely together. The Commonwealth Government have asked for help and support. They've asked for specific things for us to do. I think our nurses and doctors, our AMBOs, are equal to that task, and we will do whatever it takes to provide the best care to each and every person who needs it. It's not about what team you're on, it's not about what government regulates you. It's all about acknowledging that every one of these residents is a Victorian, and every one of these residents needs to be supported. So that's what we are doing. We're going to take that to a whole new level. There will be some inconvenience for people as other less urgent procedures are cancelled and paused, but I think people will understand and will know that the sickest patients have got to be treated quickest. That's always guided us. Beyond that, can I just again congratulate and thank every Victorian who's doing the right thing, and can I just the final message, if you have symptoms, even mild symptoms, you've got to come forward and get tested quickly. Then you've got to wait at home till you get your result, and then hopefully you don't have the virus and you can go back to that COVID normal that you were part of. But if you have the virus, then you've got to stay at home again for those 14 days. Get tested if you're sick. That's the key thing. That's the absolute key point to make. And I'll be grateful if we can continue to get that out through all of your different services. Any other issues? See you tomorrow.